The next question is, unlike the last question, it's multiple choice. So the nurse is assessing the neurovascular status of a client who returned to the surgical nursing unit 4 hours ago after undergoing aortic iliac bypass graft. The affected leg is warm. So we know that the affected leg is warm, and the nurse notes redness and edema. The pedal pulse is palpable. How should the nurse interpret the client's neurovascular status? So what the strategy that I always like to share when we're thinking about multiple choice questions is when you're stuck between two answers, you're going to read the question again. Again, we want to ask, what is the question asking us? The question that I'm getting from this is, how should the nurse interpret the client's neurovascular status? Okay. With anything, like I had mentioned, when you're studying content and so on, understand what normal is so that you know what abnormal is, so that when you see abnormal, it jumps out at you just like that. Another idea or strategy that you can use is when you're stuck between two answers, read the question again, look for the clues. So in the Sesame Street, we're kind of going back to basics of Sesame Street rule is when nothing else, three of these things belong, one of these things aren't the same. So you want to cancel. Right answers tend to be different than others. And that's the only one that's the correct or the unique response. Okay, so let's look at the answers. So the neurovascular status is normal because the increased blood flow through the leg. The neurovascular status is moderately impaired and the surgeon should be called. Or the neurovascular status is slightly deteriorating and should be monitored for another hour. The neurovascular status shows adequate arterial flow, but venous complications are arising. Okay, so what do we know with this? What we do know is we're focusing on the subject. Like we understand what normal is for someone who has had aortic iliac bypass graft. What does it look like in the immediate post-op period? What is expected? What are our pulses expected? What does the skin feel like? Do we expect any swelling or anything like that? So what are the expected outcomes? So venous complications from not moving resulting from surgery would not be apparent within the first 4 hours. So thinking about your deep vein thrombosis or something like that, it usually doesn't happen right away. So that's because they've been laying down and not moving for an extended period of time. From the remaining options, you're going to note that the pedal pulse is unchanged from admission. So there's and think about this, the effects of like sudden reperfusion of an ischemic limb. So if you were having what it looks like as, you know, when there's no blood flow, and then all of a sudden there's blood flow in that area. There would be redness from new blood flow, that skin area. So if you think of an area that's not getting any blood flow or kind of dark and maybe gray, as soon as blood starts coming to that area, then it starts getting red. In general, I always like to share with people, I teach CPR too, and share with people that once you're perfusing, you can actually see the blood flow on their chest and their trunk area. So you can see that new blood flow and the sudden change, and then also the sudden change in the pressure in the blood vessels. And that's what it's from. So, so the answer is the answer is one. It's expected outcome from surgery. Blood flow through the leg is normal, and that's pretty much. If you have any answers, of course, put it in the chat. So let's talk about a graphic type of question, another type of question that you may get, and it's what we call our graphic question. So question is, the nurse is watching the cardiac monitor and notices that a client's rhythm suddenly changes. There are no P waves, the QRS complexes are wide, and the ventricular rate is regular, but more than 140 beats per minute. The nurse determines that the client is experiencing which dysrhythmia? So earlier on, I had the poll about different types of dysrhythmias. So understanding which three lethal dysrhythmias are important so that you kind of know, just understanding what that's important, that will kind of allow you to, think about priority questions. So the nurse determines the client is experiencing which dysrhythmia. So let's look at, so understanding what sinus tachycardia is. Ventricular fibrillation, what does that look like? How does that affect your body? How does that affect cardiac output? How does that affect perfusion? Ventricular tachycardia, the arrhythmia is coming from the ventricles and it's just going too fast, or premature ventricular contractions. So the contractions are occurring, but they're just premature. That's right. Okay, so ventricular tachycardia. Okay, so we'll take a look at that. Let's see. Before we do answer. Okay, so know your patterns, cardiac arrhythmias, and then knowing how to read EKG strips. So know 4 of the patterns, normal sinus rhythm. These are your 4 main patterns. Of course, there's other ones. And let's look at the patterns. So this is what you had mentioned, ventricular tachycardia. So ventricular fibrillation. This is your, everything is just haywire. And so there's no cardiac output because the heart is just quivering. So ventricular tachycardia, it's more succinct, but it's still not giving adequate cardiac output with that, because you can have a pulse or you can have no pulse with that. Asystole, there is no pulse. There is no electrical activity or anything like that. And then your normal sinus rhythm is the normal pulse that you would get. So what do we know? We know characteristics of the EKG pattern, and then also eliminate sinus tachycardia first, because there are no P waves. So premature ventricular contractions are isolated ectopic beats, and they're imposed on the underlying rhythm. So they're added to. So they come prematurely. They come when there's supposed to be a pattern, but they're not coming when they. So that option is eliminated. So recalling that there are no true QRS complexes with VFib, that will kind of direct you to the right answer. So as you mentioned, ventricular tachycardia. So what is the let me see, the normal answers of P waves, and then it's longer than 0.12 seconds. So when you're going to be graphing, just understanding what your normal is, and then also the typical rate is between 140 to 180 impulses per minute from that.